already. And listen, it's a big task ahead for Joe. We know that. But you know what? The folks who actually have to vote on this bill, they have to read it too. So we brought in Congressman Phil Roe, and he's been carrying around this bill, the 2,000 pages with it, and he can't make heads or tails of it. The Tennessee Republican says there's no easy feat understanding this. By the way, Congressman Roe, you must be getting pretty strong biceps just carrying this thing around.
Well, if you carry 3,200 around this one around, you don't have to go to the gym, I can tell you that.
Okay, now, so you're saying you have a hard time understanding it, but what are your assumptions about it that maybe have you worried already?
Well, the concern is this, is that we have a bill that is, as you can see right here, and Joe was talking about it, he's going to start reading it, it's 2,000 pages. This should be easily understandable by the American people. I mean, when you go to your doctor, Charles, the thing that we ought to be able to say to you, when you go and you take your shirt off and your doctor, like myself, listens to you, is your health care going to be better when this is signed into law? That's what you've got to ask yourself. Am I going to get better care? And the answer to that is no. And when you look at this, there are huge taxes. Let me give you one of my big concerns about this. We have a Medicare system now that is scheduled to go broke, upside down, more money going out than coming in 2017. That's 8 years from now. They're proposing to take $400 to $500 billion out of this, and in 2011, when the baby boomers hit the retirement age, we're going to be adding 3 to 3.5 million of those people every year. And what's scheduled in 2011 is a 25% cut in the doctor's fees. Now, let me just let's do the math very quickly. You've got 30 to 35 million more people, 400 to 500 billion less dollars. You're going to decrease access, decrease quality, and increase costs. That's what you're going to do.
So now, having said that, where ultimately do you think then the money's going to come from to pay for this? It seems like you think that the statistic that they have in here or the assumptions are wrong. So where do you think ultimately the money will come from to pay for this?
Well, if it does come out of Medicare and the device companies have a 2.5% fee or tax placed on it, like a new knee replacement or new technology, you've got an individual mandate. That's a tax on someone, which they've tried in Massachusetts. And here's a mandate, meaning that you have to pay for it. You're an individual out there, and you're mandated 2.5% of your gross salary. You have to pay for this. That's a tax. Well, let me just give you the Massachusetts, one insurance company, Harvard Pilgrim Healthcare Plan. Between April of 2008 and March of 2009, 40% of their new enrollees kept the insurance for less than 5 months. And during that 5 months, they averaged spending $2,400 a month. So you waited until you got sick. You paid the fee. You waited until you got sick because you can't be denied coverage, no pre-existing conditions. And when you got well 5 months later, you dropped the insurance. 40% of your enrollees did that. People make decisions, economic decisions. Hey, this is Fox Business. People make economic decisions, and that's a decision that is perfectly logical. If you can't be turned down, wait until you have your car wrecked.
Representative, we have a minute left. I need you to help us understand, though, from your perspective, what does this mean, though, for the average Joe out there? The average person watching the show, what's the implications for them?
I think, what we're trying to do as a noble cause is to cover as many Americans as we possibly can. I mean, that's what you want to do. And unfortunately, this is a very expensive way to do it. Let me give you an example. 2 things you could do to get from 85% to 91% of our folks covered in the United States. One is leave young people on their own their parents' health insurance plan until they're 25 or 6 years old. Doesn't cost the government anything. And number 2 is simply sign people up who already qualify for a plan, Medicaid or S-CHIP. You can get to 91% of people covered by just doing those things. That's what the 1,500-page Baucus bill does with a massive government takeover of our health care system, which we don't want. And what I worry about, Charles, what my major concern as a physician is rationing of care, which happens in every public system in the world.
Congressman Phil Roe, thank you for your time this afternoon.
Thanks so much for having me on.
Appreciate it. Well, from a congressman who has to vote on the bill to